Question to the Attorney-General, representing the Minister for Health and Wellbeing on COVID-19 vaccinations in South Australia.
Is leave granted? Leave is granted.
98.1% of Australians have had one dose of the approved COVID-19 vaccines. 96.4% of people have had 2 doses of the vaccine, and 71.8% have had 3 doses. This is the first time in history when the bulk of our population have been vaccinated against the disease, yet the frequency of that disease continues at a high rate. The vaccine has been shown to not be effective in reducing transmission. There have been over 10.2 million reported cases of COVID-19 in Australia, 766,000 here in South Australia. This week alone are reported 3,037. We now have a situation in this state where people can visit a person in an aged care facility without being vaccinated at all, yet there continues to be a negative impact for people who are not classified as fully vaccinated. Several sectors continue to have policies excluding unvaccinated staff from working, and these mandated vaccination policies are based off earlier government precedents. There's been no advocacy by the government to give these sectors the confidence to alter their policies. People may not be fully vaccinated for a number of reasons, including a bad reaction to a previous dose of the vaccine, being young and healthy or having gained natural immunity from a prior infection, cultural restrictions and a genuine fear of the vaccine. My question is, what will the Malinowskis government do to reverse this damage caused by mandates which were implemented by government precedents? And will the government remove vaccine mandates for the general population, given it has no significant effect on reducing transmission?
Will the Attorney-General?
I thank the honourable for a question. I'll be happy to pass on the questions in relation to the scientific evidence for the efficacy of vaccines to the Minister in our place, and I'll bring back a reply.